This week we're going to be talking about the lymphatic and immune systems. This is again going to be lecture 1 of 2 lectures in this series, so we will be just doing the lymphatic system for this lecture, and in part 2 of this lecture we will cover the immune system. So what is the lymphatic system? This is going to be a secondary transport system that is going to be complementary to the cardiovascular system and is also going to be part of the immune system. So it has a whole lot of jobs in our body. So during the exchange of gases and nutrients and waste within the body cells, much of the blood, like the fluid part of the blood, is going to end up in spaces between cells. We refer to these as the interstitial space. So when we have these fluids in these interstitial spaces, we refer to this as interstitial fluid. The function of the lymphatic system is to reabsorb this excess interstitial fluid and transport the fluid as lymph and eventually return it to the blood as plasma. It helps to protect our body from infections by acting as part of the adaptive immune system, which produces, stores, and transports the white blood cells, known as T and B cells, around the body. And again, this is going to be what our part 2 of this lecture is about. So here are your structures of the lymphatic systems. We have lymph, which again is that liquid component. We have lymphatic vessels, and we have lots of lymphatic organs that we are going to talk about today, like the lymph nodes, the red bone marrow, the thymus, the spleen, mucosa-associated lymphoid tissue. I'll explain a lot more about what that means later. And then our specific lymphatic cells, our lymphocytes, which will be our B and T cells. This will be included in the second part of this lecture. So lymph is going to be fluid, very, very similar to blood plasma. It is going to be collected from those interstitial spaces between cells and eventually returned to the blood by the lymphatic vessels. Lymphatic vessels are going to surround blood vessels to return any lost or leaky fluid back into the bloodstream. And you can see some diagrams here of exactly how this is kind of laid out. Note that your lymphatic vessels are blind-ended tubes, whereas all of your other vessels kind of flow into one another. That's important information to know. Here's a diagram that's just showing you how your lymphatic vessels and lymph nodes are kind of laid out around your body. So lymph nodes, I'm sure you've heard this before if you've ever had strep throat or anything like that. They definitely get very inflamed when we're sick. So lymph nodes are going to be bean-shaped organs that are going to be arranged in clusters alongside blood vessels or joints. Their function is going to be to help filter pathogens, foreign molecules, and cancerous cells from the blood. They contain our lymphocytes, which again is those T cells and B cells, so they're incredibly important in that immune response. We've already talked about red bone marrow whenever we covered the skeletal system. The main thing I want you to remember for the sake of the lymphatic system is that this is what is producing our red blood cells and our white blood cells. Remember, the white blood cells are incredibly important in the lymphatic system, so it's important to go back and review and remember where they come from. So the spleen is going to function to store our red blood cells, our white blood cells, and our platelets. It also destroys old blood cells, makes antibodies for the immune response, and in general just acts like a big giant lymph node. And you can see it's right here hanging kind of off towards the back side of the stomach. Here are some different disorders that you might see of the spleen. Sometimes we see an enlarged spleen. This can be due to leukemia or other blood cancers, sometimes infections like mono or syphilis, or liver disease. We can also have a ruptured spleen. Usually the rupture will occur due to injury or illness. That's what this looks like over here. And if it's serious enough, the spleen will be removed. If it's not, sometimes we can just maintain with that going on. We already talked about the thymus in previous chapters because it is part of the lymphatic and the endocrine system. So we just talked about it last week when we were talking about endocrine. Its function is to secrete hormones that help the white blood cells, known as T lymphocytes. And again, we will talk about this on the next lecture. it helps these white blood cells mature. So it acts like a nursery for the T cells. It sits just dorsal to the sternum and the chest and superior to the heart. It's really, really important in infants and children while they're developing their immune systems. It becomes less important in adults. It typically shrinks down with age. But during those early years where you're really like cementing that immune system, it is incredibly, incredibly important. We refer to these as MALTs. What this stands for is mucosa-associated lymphatic tissue. These are going to be small concentrations of lymphatic tissue throughout the body, which are going to contain higher concentrations of immune cells. You might not be familiar with Peyer's patches because these are inside of our small intestine, but you are probably most definitely familiar with tonsils because these are in the back of our throat. These are what get inflamed when we have strep throat and things like this. And then you also probably heard of your appendix before. This is this little guy that hangs off the end of the large intestine. So these are all made up of lymphatic tissue so that they can have concentrations of immune cells all throughout the body, so that if our throat is under attack or our intestines are under attack, we actually have those immune cells just packaged and waiting and ready to go to help fight those infections. So lymphatic cells are going to work together to enact adaptive immune response, and we will talk so much about this in the next lecture. But essentially, you're going to have a few different types. You're going to have B cells and T cells, and these are both lymphocytes. These are going to be found in both the bloodstream and the lymphatic vessels and the lymph nodes. This is all stuff you should know a little bit about since we've already covered the cardiovascular system. Here is the drainage pattern of lymph. So we're going to have two main ducts that are going to help drain this lymph and get it back to the heart, because that is the goal, is to get it back into circulation and back to the heart, right? So the right lymphatic duct is going to receive lymph from the right half of the head, the neck, the thorax, and the right upper limb, the right lung, the right side of the heart, and the right surface of the liver. And then the thoracic duct is going to drain lymph from the lower limbs, the pelvic cavity, the abdominal cavity, I mean, just everything else, right? Left side of the thorax, left side of the head, the neck, and the left upper limb. This is why sometimes we can see variations whenever we do have swelling of lymph nodes. We can have different patterns of that around the body. And let's talk a little bit about lymphatic diseases and disorders, and then that will be all for this lecture, and then we'll talk about immune in part 2. So sometimes we see lymphedema. This is going to be an accumulation of lymph fluid. It usually happens in the limbs, usually in the legs, but sometimes we see this in the arms too. This can be due to just abnormalities in lymph node and vessel formation, sometimes cancers or tumors, sometimes trauma to lymphatic vessels, and occasionally due to infection or rheumatoid arthritis. We can also have cancer of the lymph nodes. We refer to this as lymphoma. It can be cancer of the lymphocytes, the T and B cells, or any other lymphatic tissue. It's going to result in swollen lymph nodes, shortness of breath, fever, night sweats, chronic fatigue, usually a little bit of weight loss, and itching all over the body. We have two major types of this, Hodgkin's and non-Hodgkin's. I don't want you guys to get too caught up on memorizing this. I'm trying really hard, since I know a lot of you are going in the direction of medicine, to start putting these body systems into a clinical perspective. So I'm just trying to give you a little bit there. But that is all that I have for this first lecture. Please don't forget to watch lecture 2, all about the immune system. And if you have any questions or anything at all, just reach out and we'll work it out. Thanks.